Yes, ma'am.
So we start clinical anatomy of the upper limb. Upper limb consists of the shoulder, arm region, elbow region, forearm, and the hand. Shoulder is subdivided into 4 regions. Shoulder is subdivided into 4 regions. Scapular region, deltoid region, axillary region, and infraclavicular region. Axillary region and infraclavicular region. So I repeat, shoulder consists of the 4 regions: deltoid region, infraclavicular region, axillary region, and scapular region. Main vessels and nerves of the shoulder region, main artery, main vein, and main plexus of the shoulder is axillary vein, axillary artery, and brachial plexus. All these vessels, main vessels and nerves of the shoulder region is present in the axillary region.
Ma'am,
Axilla. What?
Ma'am, previous lecture you said that next lecture you'll still explain the tracheostomy, like the operation part.
We continue now this portion and which one lecture we will miss also next week, student. We are starting now this region. Understand?
Ma'am, but group 9 today has a midterm and you said that you'll explain
Now,
it.
when we finish this portion, when we continue, if you will have any questions in that operation, ask me. Axilla, apex of the, it consists of the apex, which is projected to the root of the neck, and base, which is projected downward, and base is bounded anteriorly by anterior fold of the axilla, posteriorly it is bounded by posterior fold of the axilla. Medially, it is bounded by conditional line which connects these folds on the thorax. And laterally, it is bounded by conditional line which connects these folds on the arm region. Anterior fold of the axilla is formed by pectoralis major muscle. Posterior fold of the axilla is formed by latissimus dorsi muscle. Layers of the axillary region. Superficial layers of the axilla is skin, subcutaneous fat tissue, and superficial fascia. Below superficial fascia is located deep fascia of this region, below which is located the muscles, which forms the axillary fossa. Axillary fossa is the depression of the region which is formed by the muscles. Muscles which has 4 walls. 4 walls. Anterior wall of the axilla. This will be anterior wall of the axilla. Posterior wall of the axilla. Medial wall of the axilla and lateral wall of the axilla. Anterior wall of the axilla is formed by pectoralis major muscle and pectoralis minor muscle, subclavicularis muscle, and clavipectoral fascia, which covers pectoralis minor muscle and subclavicularis muscle. Posterior wall of the axilla is formed by teres major muscle and latissimus dorsi muscle. Medial wall of the axilla is formed by upper 4-5 ribs, intercostal spaces, and by the muscle which covers these intercostal spaces, serratus anterior muscle, and the lateral wall of the axilla is formed by the muscles which is located in superior third part of the arm region. This will be coracobrachialis and biceps muscle. All these vessels and nerves, main vessels and nerves of the shoulder is located in anterior wall of the axilla. Anterior wall of the axilla, which projects the infraclavicular region. Infraclavicular region, which is bounded superiorly by the clavicle. Medially, it is bounded by lateral border of the sternum. Inferiorly, it is bounded by the horizontal line which passes at the level of the third rib, and in female it will be superior border of the mammary gland. And laterally, it is bounded by medial border of the deltoid muscle. Infraclavicular region, superficial layers, skin, subcutaneous fat tissue, superficial fascia, cutaneous nerves which provides innervation of the skin of this region is supraclavicular nerves, which is branch of the cervical plexus. We have told that the supraclavicular nerves descend below the clavicle, so it innervates the skin of the lower part of the neck region, and also its branches passes below the clavicle, innervates the skin of this region. Infraclavicular region. Below the superficial fascia, we have deep fascia, which is continuation of the proper fascia of the neck, and it continues to the deltoid region, into the deep fascia of the deltoid region, and into the axillary region. It continues into the deep fascia of the axilla. It makes compartment for pectoralis major muscle. Pectoralis major muscle, which consists of three parts. It takes origin of three parts. It consists of clavicular part, sternal part, and abdominal part, and it is attached to the sulcus of the humerus. Below the pectoralis major muscle is located clavipectoral fascia, which forms the suspensory ligament of the gland, and it makes compartment for pectoralis minor muscle and also for subclavicularis muscle. Pectoralis minor muscle, so below pectoralis major muscle, we have what? Pectoralis minor muscle. This is minor muscle, which takes origin from third, fourth, 5 costal cartilages, ribs costal cartilages, and it is attached to the coracoid process of the scapula. This pectoralis minor muscle crosses these main vessels and nerves of the shoulder, which passes in this region and divides the infraclavicular region into 3 triangles: clavipectoral triangle, pectoral triangle, and subpectoral triangle. Clavipectoral triangle boundaries will be superiorly clavicle. Inferiorly, it will be bounded by superior border of pectoralis minor muscle. Pectoral triangle corresponds the location of the pectoralis minor muscle, so its boundaries will be contours upper border and the lower border of the pectoralis minor muscle, and the subpectoral triangle boundaries will be superiorly lower border of the pectoralis minor muscle, and inferiorly it will be bounded by lower border of pectoralis major muscle. So in these triangles is located what? Axillary vein, axillary artery, and brachial plexus. Vein is located medial side into these three triangles. So vein does not change its position. It is all triangles is located medially. Artery is located laterally to the vein. Laterally to the vein. So medial side in this triangle we have axillary vein. Laterally to the vein is located axillary artery, and brachial plexus. Formation of the plexus, we have told that it is formed where in the supraclavicular triangles. Then the trunk of the brachial plexus descends in clavipectoral triangle, and in clavipectoral triangle it touches the artery posteriorly and lateral side. So location of these vessels and the nerves in clavipectoral triangle from medial to the lateral side, how will be located? Most medial we have what? Axillary vein. Laterally to the vein is located axillary artery, and laterally and posteriorly to the axillary artery is located brachial plexus. In pectoral triangle, brachial plexus forms free cords. Let's see in other picture. Now these cords. Here is shown the brachial plexus. Let's remember, we have told that it is formed by C5 to T1 nerves, and these are trunks of the plexus. And in pectoral triangle, it forms the free cords. These are medial cord of the brachial plexus, lateral cord of the brachial plexus, and posterior cord of the brachial plexus. So where is located the cords of the brachial plexus in pectoral triangle? Medial cord of the brachial plexus touches the artery medial side. Lateral cord of the brachial plexus touches the artery lateral side. Posterior cord of the brachial plexus touches the artery posterior side. Now on this picture, let's see. So in pectoral triangle, medially we have what? Axillary vein. Laterally to the axillary vein is located medial cord of the brachial plexus. Laterally to it is located axillary artery, and laterally to the axillary artery is located lateral cord of the plexus. Posterior cord is located behind the artery. So I repeat, location of these vessels and nerves in pectoral triangle from medially to the lateral side. Most medially we have axillary vein. Laterally to the axillary vein is located medial cord of the brachial plexus. Laterally to the medial cord is axillary artery. Laterally to it is lateral cord of the artery. And behind the artery is located posterior cord of the brachial plexus. If we explain this cord's location to the artery in pectoral triangle. So medial side to the artery is located medial cord of the brachial plexus. Lateral cord is located laterally to the artery, and posteriorly to the artery is located posterior cord of the brachial plexus. Each cord of the brachial plexus gives off nerves, which comes down in from pectoral triangle and touches the axillary artery from different side. Medial cord of the brachial plexus gives off ulnar nerve. It gives off medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm, and it gives off medial root of the medial nerve. Lateral cord of the brachial plexus gives off musculocutaneous nerve. It gives off lateral root of the median nerve. It also gives off lateral pectoral nerve. This lateral root of the median nerve and medial root of the median nerve joins each other and forms the median nerve. Posterior cord of the brachial plexus gives off radial nerve and gives off axillary nerve. So in subpectoral triangle, we have what? Axillary vein, axillary artery, and branches of the brachial plexus. That nerves which comes from medial cord of the brachial plexus touches the artery medial side. That nerves which comes from lateral cord of the brachial plexus touches the artery lateral side. Median nerve, we have told, is formed by the union of roots of the median nerve. It touches the artery anteriorly, and that nerve which comes from posterior cord of the brachial plexus touches the artery posterior side. So in subpectoral triangle, most medially we have axillary vein. Artery is located laterally. Medially to the axillary artery, so is located ulnar nerve and cutaneous nerves. Medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. Laterally to the artery is located musculocutaneous nerve. Anteriorly to the artery is located median nerve, and posteriorly to the artery is located radial nerve and axillary nerve. In the posterior wall of the axilla, so in anterior wall of the axilla, we have triangles. Yeah, in posterior wall of the axilla, we have told posterior wall of the axilla is formed by which muscles? By teres major muscle and latissimus dorsi muscle. Here we have spaces. We have quadriangular space and we have triangular spaces. Triangular space is bounded superiorly by teres minor muscle. Inferiorly, it is bounded by teres major muscle, and laterally, it is bounded by long head of triceps muscle. Quadriangular space is this space. It is bounded superiorly by teres minor muscle, inferiorly is bounded by teres major muscle. For this space, medial border will be long head of triceps muscle, and lateral border will be surgical neck of humerus. As we have told that in these triangles, pectoralis minor muscle crosses the main vessels and the nerves, brachial plexus branches, we have told. Artery is divided into three parts. First part will be located where? In clavipectoral triangle. Second part is located in pectoral triangle, and third part is located in subpectoral triangle. First part of the axillary artery, each part gives off branches. First part of the artery gives off superior thoracic artery and thoracoacromial arteries. Superior thoracic artery and thoracoacromial artery. Second part will be this part. It gives off lateral thoracic artery, and third part of the axillary artery, so which is present in subpectoral triangle, it gives off subscapular artery, anterior and posterior circumflex humeral arteries. Subscapular artery gives off artery circumflexa scapulae and thoracodorsal artery. This artery circumflexa scapulae, which is branch of the subscapular artery, passes in triangular space, and it anastomoses to the suprascapular artery, which is branch of the thyrocervical trunk of the subclavian artery. And this anastomosis is important during ligation of the axillary artery. Axillary artery down at the level of the lower border of teres major muscle down continues to the brachial artery. So when there is bleeding from the axillary artery must be ligated not below the exit of the subscapular artery, but proximally above the exit of the subscapular artery. So here in pectoral triangle or upward in clavipectoral triangle. So in a triangular space, so we have artery circumflexa scapulae, here is shown artery circumflexa scapulae, which passes and anastomoses to the suprascapular artery, and in quadriangular space passes posterior circumflex humeral artery, branch of the third part of the axillary artery, accompanied with axillary nerve, and from this space it enters into the deltoid region, and this artery and nerve is main vessel and nerves of the deltoid region. At the level of the surgical neck of the humerus, anterior and posterior circumflex humeral arteries anastomoses to each other. And that's why when there is fractured the humerus and is bleeding from the vessels, bleeding so occurs from which arteries? Bleeding occurs from anterior and posterior circumflex humeral arteries, because these arteries makes anastomosis here at the level of the surgical neck of the humerus. Do we understand? Do we understand? Yes. So I repeat now, in anterior wall of the axilla, we have so triangles, clavipectoral triangle, pectoral triangle and the subpectoral triangle. In clavipectoral triangle, location of the vessels from medially to the lateral side. Medially we have vein, laterally we have artery, laterally to the artery we have cord of the we have brachial plexus. In pectoral triangle, most medially, we have axillary vein. Laterally to the vein, we have axillary artery. And in pectoral triangle, we have cords of the brachial plexus. Medial cord, lateral cord, and posterior cord. Medial cord lies medially to the artery. Lateral cord lies laterally to the artery. Posterior cord lies behind the artery. In subpectoral triangle, medially we have axillary vein, laterally to the vein we have axillary artery. The cords of the brachial plexus, branches of the cords of the brachial plexus descends in subpectoral triangle, which touches the artery different sides. That nerve which comes from medial cord of the plexus touches the artery medial side. So medial side to the artery, we have ulnar nerve, we have medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. Lateral side, we have musculocutaneous nerve. Posterior side to the artery, we have axillary nerve and we have radial nerve. Median nerve is located anteriorly to the artery. In posterior wall of the axilla, we have spaces, triangular space and quadriangular space. Branch of the subscapular artery, artery circumflexa scapulae passes in triangular space where it anastomoses to the suprascapular artery. In quadriangular space, we have axillary nerve and branch of the third part of the axillary artery. This is posterior circumflex humeral artery. In scapular region, superficial layers of the scapular region, we have skin, subcutaneous fat tissue, and superficial fascia. Skin of this region is supplied by supraclavicular nerves, branches of the cervical plexus. Below this superficial layer is located deep fascia, which covers the muscles. More superficially on the shoulder, we have deltoid muscle, we have trapezius muscle, and we have latissimus dorsi muscle. Below the deep fascia on the scapular region, we have supraspinatus muscle, infraspinatus muscle, spine of the scapula above and below forms the supraspinatus fossa and infraspinatus fossa. In supraspinatus fossa is located supraspinatus muscle. Infraspinatus fossa is located the infraspinatus muscle. And also deeply in the scapular region, we have teres minor and teres major muscle. Teres minor and the major muscle, between which we have the spaces, triangular space and quadriangular spaces, where passes the vessels and the nerves. In triangular space, we have artery circumflexa scapulae, a branch of the subscapular artery which makes anastomosis to the suprascapular artery. In quadriangular space, we have posterior circumflex humeral artery and we have axillary nerve. At the level of the below this deep group of the muscles, anastomosis between artery circumflexa scapulae and suprascapular artery is formed in scapular region, and the main vessels and the nerves of this region, which provides innervation and blood supply of these tissues, are suprascapular artery and suprascapular nerve. Deltoid region corresponds to the location of the deltoid muscle, which covers the shoulder joint. Superficial layers of the deltoid region are skin, subcutaneous fat tissue, and superficial fascia. Cutaneous nerve, which is located on this region, are supraclavicular nerves, branches of the cervical plexus, which provides innervation of the skin of this region. Below the superficial fascia is located deep fascia, proper fascia, which is continuation of the deep fascia of the infraclavicular region. It gives off septas through the muscle, through the deltoid muscle, which divides the deltoid muscle into three parts: anterior part, middle part, and posterior part. Different parts of the deltoid muscle has different function. Anterior part of the deltoid muscle flexes the arm. Posterior part of the deltoid muscle extends the arm, and middle part of the deltoid muscle abducts the arm. Abducts the arm. Below the deltoid muscle, is located subdeltoid space. Subdeltoid space, which includes vessels, nerves, and synovial bursas. So subdeltoid space is located between what? Deltoid muscle and the humerus. And main vessels and nerves of the deltoid region will be which vessels and nerves? We have told that this will be posterior circumflex humeral artery and axillary nerve. So axillary nerve, posterior circumflex humeral artery, which at the level of the surgical neck of humerus anastomoses to the anterior circumflex humeral artery. So main vessels and nerves of the deltoid region, I repeat, will be axillary nerve, anterior and posterior circumflex humeral arteries. Axillary nerve is branch of the posterior cord of the brachial plexus. Anterior and posterior circumflex humeral arteries are branches of the third part of the axillary artery. Do we understand? Yes. So we don't have time. So next lecture we continue the following portion. Now ask me which question you have. Somebody have told me about neck region. Have we any question?
Ma'am, we didn't have lecture on operation on the neck.
Tracheostomy. Why you don't have lecture? As I know you have lecture. Public holiday, you don't have lecture. Yes, one lecture, help me. So what you have not understand? That for tracheostomy operation, yeah? Tracheostomy. What have you don't understand in this operation? Ask me what you don't understand at this operation.
Ma'am, could you talk about subtotal thyroidectomy?
Thyroidectomy, what have you don't understand?
Ma'am, like how the incisions are made.
First tracheostomy, now thyroidectomy. Tracheostomy, what you don't understand? Which group are you? Group 9 must have lecture in other batch. And what was problem? You don't have lecture also. You also don't have lecture. Second batch, yeah, yes. Then? Then? Tracheostomy. Tracheostomy, what does it mean? Tracheostomy means what? To make what? Fistula on the trachea. What is indication of this operation? When is done tracheostomy operation? When there is what? Asphyxia, when there is no air passage into the trachea. Cause of the asphyxia, what may be? Trauma of the trachea, bacterial infection, tumor of the thyroid gland when pushes the organ, makes obstruction of the organ, and when there is no passage into the organ. At this case is done tracheostomy operation. Fistula is applied on the organ according what level is dissected the trachea. There are distinguished superior tracheostomy, middle tracheostomy, and inferior tracheostomy. Instruments which are used during this surgery are which instruments? Main surgical instruments which are used during this operation is which instruments? One-tipped hook, trousseau dissector, retractors, scalpel, scissors. Instrument of special function which is used during this operation is which instrument? Tracheostomial tube. Tracheostomial tube. And incision which is performed during this operation. Which incision is performed? Who tells me?
Horizontal and vertical.
Horizontal and vertical incision. The horizontal incision when is performed? During which tracheostomy?
Ma'am, superior.
Superior tracheostomy. Longitudinal incision?
Ma'am, inferior.
Inferior. Which tissues is dissected during tracheostomy operation? Which tissues is dissected during tracheostomy operation? Before parietal layer of fourth fascia, which fascia is located there? Third fascia. Third fascia, yeah? Third fascia. Third fascia, which deep layer of the proper fascia, which makes compartment for which muscles?
Infrahyoid.
Infrahyoid muscle. So sheath of the infrahyoid muscle must be opened. Fascia is dissected and is shown what? The muscles, yeah? Infrahyoid muscles. Muscles is dissected. No, it is retracted at side, yeah? Infrahyoid muscle, sternohyoid and sternothyroid muscle is retracted aside to access the trachea. Superior tracheostomy, where is performed? At what level of the trachea?
Above thyroid isthmus.
Above, so it is at what level of the thyroid?
10 seconds.
Which rings of the trachea?
First and second.
First and second rings of the trachea. Middle tracheostomy? At what level? So, superior tracheostomy is performed at the level of the first and second trachea rings. Middle tracheostomy is performed at the level of the isthmus of the thyroid gland, so third and fourth trachea rings. And inferior tracheostomy is performed below the isthmus of the thyroid gland at the level of 4-5 trachea rings. So aim of the operation is what? That lumen of the trachea must be what? Opened, yeah? Opened. Which incision is performed on the trachea? On the organ, which incision is performed?
Ma'am, is it vertical?
Vertical, maybe cross-shaped incision, transverse incision. And from these different types of incision, horizontal incision is most rational incision, which is performed between the cartilages of the trachea. And is dissected the layers of the organ, so anterior wall of the trachea, and the lumen of the trachea is opened. Then what is done? What is done after the lumen is opened of the organ?
Ma'am, the trachea tube is
Trachea tube is inserted into the organ, yeah?
yes, ma'am.
Which is holded on the neck. And how long must be located this tracheostomial tube in the organ? How long it must be located? How long it must be located in the organ? It depends on what? On the indication of the operation. Why you performed the tracheostomy operation. If indication of the operation is foreign bodies, which is located in the organ, so when the trachea is dissected and foreign bodies is removed from the organ, there is not necessary long time to locate tracheostomial tube into the organ, yeah? If the indication cause of the operation is tumor of the thyroid gland, which is non-operable, pushes organ and makes obstruction of the organ, yeah? Gland is non-operable. So at this case, it may be located long time into the organ. So, location of the tracheostomial tube in the organ depends what is indication of the operation. What complication may happen during this operation?
Lesion of jugular venous arch.
Oh, during which tracheostomy? Jugular venous arch, maybe?
Inferior tracheostomy.
Inferior tracheostomy, yeah? And what must be done if it's damaged, inferior jugular venous arch? What may develop? And what must be done if it is accidentally damaged?
Ligation.
Ligation. Why? Why immediate ligation must be performed if it is accidentally dissected?
It will cause hemorrhage.
Hemorrhage.
Ma'am,
Hemorrhage.
no, ma'am, can you
Hemorrhage, it is vein. And we have told that these superficial veins are what? Closely attached. Outer wall of this vein is closely attached to what? Superficial fascias. And when these veins are damaged, it what? Can't be contracted itself. And maybe develop air embolism. So when superficial veins are damaged accidentally during the surgery, that's why it must be immediately ligated, not to develop air embolism. Also, what complication may be developed? Yes, it's located behind the trachea. Yeah? And behind the trachea also, if it's dissected, posterior wall of the trachea, during surgery, which nerve may be damaged there? Between trachea and the esophagus passes which nerve?
Recurrent laryngeal nerve.
Recurrent laryngeal nerve. In the sulcus passes recurrent laryngeal nerve. And this recurrent laryngeal nerve, we have told, innervates what?
The trachea, a thyroid gland.
Thyroid gland. And also what innervates? Also what innervates? Except these organs. It innervates what? Vocal folds. Vocal folds. And that's why if this nerve is mostly it is maybe damaged in the thyroidectomy operation, but in this operation also it may be damaged because it passes posterior wall of the trachea. And if the nerve is damaged, maybe develop what? Aphonia. Patient may lose the voice because this nerve, except innervation of the organs, also innervates the vocal folds. Do we understand? Okay. If here is my students also for the next week, next class, I start reading the upper extremity, shoulder region. Shoulder region. Understand? Okay, have we any question? No. No?
No, ma'am.
Goodbye. Thank you.
Thank you.